Good afternoon. My name is Anike Golokoti.
I'm Ada Mesita.
My name is Maddie Medvitz.
My name is Cole Rogaliner.
And this is Who's Surviving. So, who should receive the heart? The clear choice is patient D. Patient D shows serious work ethic. And the first reason is sustainability. He works in a consistent job, and he lives in healthy conditions. And this shows one of the reasons why he should receive the heart. Moreover, he is not taking any substance or any drugs in the first place. He lives in a tobacco-free, smoking-free, and alcohol-free environment in an upper-class home with his wife and family. Moreover, he is a dedicated father to support his 3 young little girls, and he embodies a positive role model upon them. And okay, just move.
So, sustainability. He's in the upper middle class, and this is very beneficial for him and his family because, as you could assume, heart transplants are very, very expensive. A Milliman research report found that heart transplants come to be about $1.6 million, and for anyone, that's a lot of money. Even though he is upper middle class, that is still a huge chunk of money. Fortunately for him, he does have insurance because of the company he works at. He works at an advertising company, and this company will cover almost the whole cost of the procedure. And one of the reasons we chose him instead of patient E was because patient E does not have any insurance, and out-of-pocket costs at $1.6 million, that's not doable. And as you can see in this chart, the breakdown percentages, each sector is a different fee, and with this many fees, insurance covers a lot of it, but even though it covers a lot, there's still out-of-pocket fines that are in there, and because he's in the upper middle class and has a good job, he is able to have funds for that and is able to provide the money for that.
Next, we also chose patient D because of his incredible health track record. First, patient D doesn't have any pre-surgery substance abuse of any kind. So he doesn't have any smoking habits, any alcoholism, or any drug use. He also doesn't have any diseases or sicknesses that can negatively impact the outcome of his surgery. According to the data from the American Journal of Heart Transplantation, as you can see in this chart, the median years lived after heart transplant surgery is compared between a smoking and a non-smoking patient. The smoking patient lives fairly less years after the heart transplant compared to the non-smoking patient. Therefore, since our patient doesn't have any pre-substance abuse of any kind, it will make him way more likely to not develop any new habits after the heart transplant. Our patient also has a family, a very big family that includes 3 girls that will motivate him along the way so that he doesn't get off track or develops any new habits.
Next, influence. Our patient is the father of 3 daughters. The influence that a father has on his daughter's life is something that is unmistakable and irreplaceable. A report from the Association of Child Psychotherapists says that the impact that a father has on their daughter's life can influence their self-esteem and sense of worth, determined specifically in their teenage years. Unlike patient C, who does not have time for family and they cannot interact with them. Alongside the positives, the loss of patient D, if he was not selected, would have to go along with just the devastation of his family. A research report from the National Health Institution says that women that end up losing their parents have an increased rate of depression. Patient E has no family that would be affected by this.
In conclusion, we are confident in our selection with patient D. This is because of sustainability, good health, and influence. And more in depth, he's in a correct working environment and he lives in healthy conditions. And he has no previous drug use, including tobacco, cigarettes, and alcohol. And he is a founding father influence, and he has this influence over his 3 young girls, and those 3 young girls will help the society in the future because of his guidance. And for these reasons, we urge you to select patient D. Thank you.
Thank you.